mallet fingers do great. Once they're healed, they pretty much return to full function. A PIP fracture dislocation, if it's a simple one, patients do great. It's one that's more complex. It's not a simple fracture. There are quite a bit of small fragments on there. Some of those could be devastating. A lot of them never go back to full function. So it really depends on kind of what it looks like. But I think really, some of these, it's a whole spectrum. Some could be pretty simple, some are pretty complex. Once it's reattached, once it's healed, patients do quite well. It's not uncommon that even if surgery goes perfectly, that the finger might have a slight droop to it. So instead of a perfectly straight finger, there might be just a very slight droop to the finger. But for an athlete, certainly for a football player, that little bit of droop shouldn't really have an effect on his function overall. Assuming he has his range of motion back, assuming he's pain-free, I think we could be pretty confident that Russell's going to be back to his old self and throwing the football again. Certainly 4 weeks is on the extreme as far as an extremely fast recovery. This is typically an 8-week recovery process as far as full healing. We tell patients all the time, if you re-injure that exact same finger prior to 3 months, there's always a risk the tendon re-tears. It takes the body about 3 months for a tendon to heal, for the bones to heal. So whether it's a fracture or a tendon injury, it's about a 3-month process. I think he has a benefit of surgery does speed up the recovery process, having surgery, and then just afterwards having that 24/7 training staff and having a patient again like Russell who's so motivated, and also just in some ways he's built differently than you or I. He feels faster, and just that's really the reality of it is I think athletes are built a little bit differently.